people who know me know that I've spent my life focused on trying to understand the mechanisms that are responsible for glomerular diseases in general. I've been in this business now for about 30 years. I've kind of had a varied scientific career, one that began in the laboratory really as a cell-signaling individual, somebody who studies the process by which cells signal internally to regulate their function. That work really evolved to understanding the biology, really the cell biology of the podocyte cell that is one of the key components of the glomerular filter. I was there kind of toward the beginning when it was recognized that the podocyte was, in many forms of glomerular disease, really the center of the universe. And so my work evolved to understanding particularly the signaling of a protein called nephrin, which is a key element of the foot process intercellular junction, what most people think of as the slit diaphragm. And that's where my work has been for many, many years. As part of that work and my interest in glomerular disease, Matthias Kretzler and I, when we were at the University of Michigan, founded a large NIH observational cohort called Neptune, which has now for more than 15 years collected observational data on glomerular disease patients and made that information available to the large research community that's interested in understanding the clinical aspects as well as the biology of glomerular disease. Our prayer has been that ultimately the data set that's assembled by all the work that goes into collecting this data will result in tools, clinical tools, that will allow us to help define better how to treat patients or what their outcome will be or what the best medications are that they should use. And I think we've made a lot of progress in that direction, really thanks to the work of many, many individuals. We've really created a community by this work of medical centers, academic centers, really around the world. And it's really fun to watch. It's gratifying to see the successes that are coming out of this work. And it's really proud to have been part of I'm very proud to have been part of that process.
My name is Jordy Cohen, more formally Jordana Cohen. I'm a nephrologist, epidemiologist, and hypertension specialist here at the University of Pennsylvania. I'm a clinical and translational hypertension researcher. I lead several trials and observational studies, thinking deeply about the measurement and management of hypertension. Particularly, I focus on how to manage hypertension in high-risk patient populations, such as people with chronic kidney disease and people with heart failure with preserved ejection fraction. I also think a lot about how to measure blood pressure better and run several studies where we're trying to identify the best way to measure blood pressures in our patients.
Hi, my name's Peter Reese. I'm a transplant nephrologist and a transplant scientist. My goal in my research is to try to help grow the supply of organs so that more people can benefit from transplant. So I've been at Penn for 17 years. It's been a great place to be and to thrive as a scientist. My research focuses on epidemiology and clinical trials and medical ethics. Most of what I do focuses on trying to get more transplants to happen. Some of our most well-known work involves using organs that no one wanted to use, and these were organs from donors with hepatitis C virus infection. Back around 2016, with some colleagues, we proposed to use these organs for transplantation because new medicines had been developed that could cure hepatitis C. As a result of this work, we've been able to increase the number of transplants in the United States by 1,000 or more every year. This was wonderful work to be involved in because it was so interdisciplinary. I partnered very closely with Dr. Goldberg of hepatology, Dr. Apt of surgery, Dr. Blumberg of infectious diseases. There were so many people involved and patients involved. And through this, we explored the clinical outcomes, the ethics, translational work having to do with virology and antibody production. The work really was a great example of how many resources there are on Penn's campus. People are eager to collaborate. It's really common to collaborate across disciplines, and everything's here. There's really no tool that you might want to use in epidemiology or statistics, in translational medicine, basic science, policy making, that you can't find one or more experts in on this campus. So that's been wonderful. In the future, a lot of our work, I think, will continue to focus on clinical trials. We're very interested in reducing the immunological complications of transplant. We're also really interested in the patient experience in transplant. We know that health equity is a huge issue in nephrology and transplant. There are many patients who could benefit from transplant, home dialysis, palliative care, who it's never offered to them. So we really also, in addition to coming up with clinical tools and new medical treatments, we want to innovate on the edge of education and medical ethics to make sure that everyone is aware and well educated and treated fairly in the nephrology space.
So I started this year the Master's of Science of Clinical Epidemiology, and it's helping me develop the skills that I need to study non-proteinuric kidney disease, which is my current interest, and the mentorship that Penn has offered to help me through, study design, learning the statistical skills that I need, and starting on, getting my own grants has been unmatched.